Good evening, everyone. We're a bit late, but we're starting this quiz MCQs. So we are going to have this MCQs last one for this month. This is going to be again little region wise, like we have head and neck topics, and then we came to the face topics, and then we were talking about the neck structures. So today also we will have some MCQs. Let's see from where shall we start. We have done with the 14th, 15th, all this is done. So we'll just go down and see what is not touched. Okay, so I think this is where we stopped. We stopped at section 3 from CNS. That was section 1, section 2, and section 3. This is where we stopped. We are going to start with this one. Okay. Let's see if there is anyone who has any queries or questions they want to ask. Okay. Let me just quickly go to them. Okay. The first question says, cervical sympathetic trunk. Now, since we are little 5 minutes late, we'll start with the questions directly, and later I'll come down to the other explanations about who I am, introduction, and all that we can do little later. So the cervical sympathetic trunk, the first option is lies anterior to the scalene muscle. Now there are few things. We can highlight down. Okay. Lies anterior to the scalenus anterior. Is it anterior to the scalenus anterior? It is enclosed in carotid sheath. I don't think so. It is not inside the carotid sheath. Does it lie anterior to scalenus anterior? It is scalenus anterior muscle. Now, all these scalene muscles, there is a scalene tubercle. So scalene tubercle in front of it, and behind it is the subclavian vessels, not the scalene. And then it is lateral to the vertebral artery. So what is this lateral to the vertebral artery? Lateral to the vertebral artery is also not correct. Next you have each ganglion gives off a cardiac branch. Now, is this the right answer? Each ganglion gives off a cardiac branch. Next one, disruption causes meiosis, ptosis, and increased sweating. So all these are the options. Now here I would say the answer would be ganglion gives off a cardiac branch. So this is the answer. So the answer is D. Okay, what is your answer? Let's see how many of you are answering. Now we don't have anyone who is answering. Right now we'll wait for the people to join in. But this is the answer for the first one. Next one, the oculomotor nerve. The oculomotor nerve, these are the options that is given. Does not enter the cavernous sinus. It supplies the ciliary muscle. It emerges from the pons. Contains sympathetic fibers from Edinger-Westphal nucleus. E does not pass through tendinous ring. So all these are the options. Now, which one is the answer? So what do you think is the answer? So oculomotor nerve, now if this is the superior orbital fissure, there is this tendinous ring. You have superior and inferior division of oculomotor. you have nasociliary and abducent. All these are the nerves passing through the tendinous ring. Okay, so now does not pass through the tendinous ring, they say. It passes through the tendinous ring. So this is a correct statement. So they are asking you to find the statement which is incorrect. Okay. So now it does not enter the cavernous sinus. It does enter the cavernous sinus. It is one of the content in the lateral wall of the cavernous sinus. Next, emerges from the pons. This is also correct. So now it contains sympathetic fibers from Edinger-Westphal nucleus. Now you tell me the one which does not hold good. It supplies the ciliary muscle. So this is the one which does not hold good. So the answer is B, that is supplies the ciliary muscles. Now let's see the next question. The Corda tympani carries. Now Corda tympani is a branch from the facial nerve. So facial nerve gives various branches, but Corda tympani is a branch from the facial nerve, and that is at its second bend, where it bends inside the petrous part of the temporal bone. So this is where it is. Okay. So now you have this Corda tympani carries what kind of fibers they're asking. This is a special sensory. This is a special sensory. So it would carry the fibers, that is taste fibers. Taste fibers from the tongue. So now is it posterior third of the tongue? This is not correct. Ordinary sensation. There is nothing like ordinary sensation. So that is also wrong. Cervical sympathetic fibers, that is also wrong. The fibers from the anterior two-third of the tongue, this is correct because the anterior two-third of the tongue has papillae. And they are the ones which give all this taste sensation to the Corda tympani, which is carried through the Corda tympani. Now, motor fibers to the muscle of mastication, that is through actually mandibular nerve. So mandibular nerve is the one which carries. So that is also not correct. So the answer is taste fibers from anterior two-third of the tongue. Okay, so that is the answer. Next one, 3C is the answer. Which one is not a branch of? Now here, which one is not a branch of? Which one is not a branch of facial nerve? Now there are various branches. We are talking about the one which is not a branch of facial nerve. Is nerve to stapedius a branch? Yes, it is a branch. Is Corda tympani a branch? Yes. What about levator anguli oris? Levator anguli oris, is it a branch? Greater superficial petrosal, is it a branch? This is the branch. Levator anguli oris, this is one of the muscle of mastication. So all this is muscles of mastication. Sorry, muscles of facial expression. This is muscles of facial . Okay, so the one which is not supplied by facial is the auriculotemporal, because this is a branch from mandibular. This is a branch from the mandibular. So it is a branch from the first arch. Okay, first arch derivative, that is mandibular, and this is a sensory nerve. and it is not a branch from the facial. So the answer here would be E, 4E. Okay, next one. Regarding the lymphatic drainage of the head and neck, which one is incorrect? We have to pick the one which is incorrect. Which one does not hold good? That is what we are talking about. Regarding the lymphatic drainage of the head and neck, identify the one which is incorrect. Now the answers are superficial cervical nodes lie along the external jugular vein. That is the first one. Is it superficial cervical nodes? Now remember, there is external jugular vein in the neck just below the platysma. That's why this is also superficial. This is also superficial. Next, submandibular lymph nodes are lateral to submental lymph nodes. Next, the left jugular lymph node, lymph trunk drains into thoracic duct. Jugulodigastric nodes lie on near the tendon of omohyoid. Preauricular nodes are outside and within the capsule of the parotid. Preauricular is in front of auricle. This is in front of. Okay, so you have to remember, this is a correct statement. 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 All these are correct statements except the one which is A. Superficial cervical nodes lie along external jugular vein. So this is a wrong statement. It is not true. And this is the answer 5A. Okay, next one. The middle meningeal artery is a branch of. Now, middle meningeal artery is a branch of which one? We're talking about the middle meningeal artery is a branch of which one? Now, there are various branches that go to the different parts of the maxilla area. So the maxillary artery divides into many branches. It has its first part, second part, and the third part, right? So you also have this various other branches. The middle meningeal artery is a branch of which part of maxillary artery? Now, maxillary artery has the first part. You can remember this as DAMAI. Second one is all muscular branches. Third one, you remember this as big pass. So 6 branches, 4 branches, and 5 branches. So you see this M here. This is nothing but the middle meningeal artery. So what is the answer? The answer is D. The answer is D, which says the maxillary artery. So this is the answer. So the answer we pick is D, because DAMAI. So this is deep temporal, accessory meningeal, then this is middle meningeal, and then there is this inferior or alveolar nerve. All these are, or this one is again, all these are the ones which are very close to the mandibular part. This is. The first branch is all the branches are very close to the joint cavity, that is TM joint cavity. So you have to remember all these in terms of inferior alveolar also goes to the lower jaw, then accessory meningeal, middle meningeal, deep temporal, everything. So 5 branches are present. So remember this, M is for the middle meningeal. Okay, next one. Next one, Let's see the question. Which is not a content of the posterior triangle of the neck? Which is not a content of posterior triangle of the neck? Now, there are various contents in the posterior triangle, but here they're asking you which one is not a content. Which one is not a content? So posterior triangle, what are the contents? Is there omohyoid muscle? Is there omohyoid muscle? Yes. Is there transverse cervical vein? Yes, it is a content. Lymph nodes are present. Subclavian artery is part of the posterior triangle. So what is not a content? The sternocleidomastoid is not a content, but it is a boundary. That is on the posterior triangle. So it is the anterior boundary for the triangle. So the answer is 7E. Next one, we'll go to the next one. Okay. Let's wait for more people to join in, Rishabh. We will have a discussion. So I'm just telling the answers and giving the answers and then not discussing much because we need more people to join in. So then we can do. All right. Now, which laryngeal muscle abducts the vocal cord? Now, there is adduction, abduction, both the actions are there. So, of the vocal cord. So, adduction is done by all the muscles. Abduction is done by only one muscle. Which is that muscle? Is it cricothyroid? Is it transverse arytenoid? Vocalis thyroarytenoid? So, all these things. This one, cricothyroid, actually tenses the vocal cord. Okay, all this will do adduction. This will do adduction. Except the one which you can see here, posterior cricoarytenoid, which will do abduction. This will do abduction. And the answer here is 8A. Okay, so with this answers, you should be able to understand. So now here there are so many muscles in the larynx. There are about 8 muscles and 9 cartilages. Out of that, 6 is paired. There are 3 which are unpaired. Unpaired, and this is paired. Next one. We'll go to a little bit of head and neck anatomy. We'll take up these MCQs and see what we can find. So now regarding the bones of the skull, the various statements are there. The middle cranial fossa does not extend to posterior cranial vault. So it does not extend to posterior cranial vault. That is one statement. The temporal lobe rests on the bone rather than the membranous part of the middle cranial fossa. The posterior cranial fossa contains cerebellum and lies superior to the tentorium cerebelli. Is it tentorium cerebelli superior to that? What is the answer? And then there is the floor of the anterior cranial fossa is formed from the orbital plate of parietal? No. The cribriform plate lies in the midline and is formed by roof of the sphenoid. No, it is the ethmoid. So this is also a wrong statement. The temporal lobe rests on the bone rather than the membranous part of the middle cranial fossa. So this is something temporal lobe because it actually rests on the bone rather than the membranous part of middle cranial fossa. Now in the middle you have this pituitary gland. And then you have cavernous sinus. So what happens is the temporal lobe actually sits on the bone rather than the membranous part, which is occupied by the pituitary gland and the cavernous sinus. So the answer I would pick is B. So the answer here is 1B. That is the answer. Next one. Regarding the bones of the skull, the anterior clinoid process are formed by lesser wing of sphenoid. The anterior clinoid process is formed by lesser wing of the sphenoid, and posterior clinoid process is formed from the occipital bone. Now, which one is correct? We have to find out. Then there is dorsum sellae that is formed from anterior part of occipital. This is wrong. This is dorsum sellae is formed by the sphenoid. Posterior clinoid process is formed by the again sphenoid. The anterior clinoid process are formed by the lesser wings of the sphenoid. The petrous temporal bone forms floor of the middle cranial fossa, but not wall of the posterior cranial fossa. But this is a correct statement. So now we have to pick the one which is different. Now the inferior orbital fissure separates the lesser and the greater wings of the sphenoid. Which one is a correct statement? Anybody? Okay, here I would pick the answer as 2A. The anterior clinoid process is formed by the lesser wing of sphenoid bone. So this is 2A. Answer is 2A. Next one. Regarding the cervical spine, all the 7 vertebrae, that cervical vertebrae, have spinous processes. Is that correct? Or the next one, the rotatory movements of the head occur mostly in atlanto-occipital joint. So this is also a wrong statement. This is also a wrong statement. Odontoid process or the dens is encased by a bony canal in the axis. No, in the atlas. This is. Next, all 7 cervical vertebrae have foramen transversarium for the vertebral artery to pass through it. So is this true? This is also not true because the 7th one does not have it. The 7th one does not have it. Next, the spinous process were present or all bifid except for the C7. So this C7 does not have a bifid. No bifid spine. No bifid spine in the C7. So this is one thing. So you must remember regarding the cervical spines, all these statements are there. I would pick the one which is correct. Which one is correct? The correct one is the 3E. Okay. So with all these statements, we'll move on to the next one. That is the 4th one. The 4th one says, regarding the triangle of the neck, there are various triangles in the neck. There is an anterior triangle. There is a posterior triangle. Again, anterior is divided into submental, submandibular, carotid, muscular. All these are present. Okay. Now, regarding the triangles of the neck, the posterior triangle is bounded by which one? Posterior triangle is bounded by trapezius, sternocleidomastoid and middle quarter of the clavicle. Is it true? So many things. It is not middle quarter. It is the lateral. Next, the anterior triangle is further divided into two smaller triangles. No, it is four small triangles. Next, the posterior belly of digastric. The posterior belly of digastric separates the carotid and submandibular triangles. Is it posterior belly that separates the carotid and submandibular triangles? So what is the answer? Is this the correct? The posterior belly actually separates the carotid and the submandibular triangle. So I feel this is the right statement. 4C is the correct statement. The accessory nerve divides the posterior triangle into two halves. No, this is not correct. The investing layer of deep cervical fascia, it actually splits to enclose the sternocleidomastoid and trapezius. Okay, we have Tony and Rishabh. All right, let's see whether you can answer. There was some confusion with the timings. Many thought I'm starting at 7 o'clock today, but it started at 6. I was talking about the 7 o'clock class that is for tomorrow onwards, from June onwards, but many said that it is, many thought that it was from today. So there was some confusion, and here we are at 6 o'clock. But today, since it is May 31st, we are sticking to the same old timings. From tomorrow, that is 1st June, the timings are changed. Okay. So the answer is the investing fascia. Actually, this is correct. Investing fascia encloses sternocleidomastoid and trapezius. But parotid and submandibular glands lie deep to the fascia in the anterior triangle. So now this is not correct. So first half is correct. The second half is wrong. So we can't take this. This is the wrong answer. Now we have to pick the correct one. So here the answer is C, that is 4C. Okay, next one. Regarding anatomy of the neck. Regarding the anatomy of the neck. So there are various landmarks. The arch of cricoid cartilage is palpable as it protrudes forward of the trachea. Fifth one we are talking about. Arch of cricoid cartilage is palpable. So the cricoid is actually a half ring, right? There is this cricoid which is a half ring. It is not a complete ring, it's a half ring. So what happens here is like so it is protruding towards the forward of the trachea. That is first statement. The cricoid cartilage marks the level C5. Is it correct? The transverse process of the axis is most prominent of the cervical transverse processes and is palpable between angle of the mandible and mastoid process. Is this the correct statement? So many landmarks are there. The body of the hyoid is not palpable because it is hidden behind the thyroid cartilage. Is this correct? Hyoid bone is higher and thyroid cartilage is lower. Coracoid process of the scapula is palpable within the deltopectoral triangle. So now which statement should you take? Which statement is right? Various landmarks are there. Which statement should you take? I would go with the statement A. The arch of cricoid cartilage is palpable as it protrudes forward of the trachea. The cricoid cartilage marks the level of C5. C5, but it is between C4 and C5. So the answer is A, 5A. Okay, next one. Sixth one. Regarding the fascia and sheaths of the neck. Pretracheal fascia, pretracheal in front of the trachea, contains both the trachea, esophagus, and also splits to develop the lobes of the thyroid. Also splits to envelop the lobes of the thyroid gland. The pretracheal fascia contains both the trachea and esophagus. Splits to envelop the lobes of the thyroid gland. So is this correct? First one. Next one, prevertebral fascia. It is in front of the vertebrae. It encloses the vertebrae. It is in front of the vertebrae. How can it enclose the vertebrae? So this itself is wrong. It is in front. Prevertebral is in front. And next one, the investing fascia encloses trapezius, sternocleidomastoid, and platysma. It does not include platysma. Next, the structures contained within carotid sheath include, this is outside. This is internal carotid. Next, infection may track in the pretracheal space to the mediastinum. Is this the correct statement? Will it cross into the mediastinum? No, actually it merges with the fibrous pericardium. So it will not track. This is also wrong. This is also wrong. So what is the answer? The answer is 6A. So the answer is 6A. Okay. Next, seventh one. We'll go to the seventh one. For sternocleidomastoid, which one is true? Which one is true for sternocleidomastoid? The contraction of one muscle rotates the head. Does it rotate the head, first of all? It's not for rotation. It is for flexion. So it's the wrong statement. It is crossed superficially by external jugular. Is it crossed by external jugular? Superficially by external jugular. This lies between platysma and sternocleidomastoid. So it is a correct statement. It is supplied by this? No. Its clavicular fibers mainly insert into superior nuchal line. Oh no. Clavicular fibers. What is this? Next, it is superficial to deep cervical fascia. The statement is wrong. So the answer is 7B. Next one. Eighth one, which is not considered a content of the posterior triangle of the neck. Now, which one is not a content of posterior triangle? There are various contents. Which one is not a content of the posterior triangle of the neck? They are asking you. Anybody? Subclavian artery, is it a content? No. Trunks of brachial plexus, you can't say it is a content because it is just passing through that triangle. Internal jugular vein is not considered a content. This is passing through. So this is a content. That's why it is a content. Internal jugular vein, is it a content? It is a content or not? Branches of cervical plexus, this also passes through. Then accessory nerve, of course it passes through. So the only thing that does not is internal jugular vein. Internal jugular is in the carotid triangle, right? So where it will come in the posterior triangle? It will not come. Carotid triangle belongs to which triangle? Carotid triangle is part of anterior triangle. So that's why it is not a part of the posterior triangle. So the answer is here is the 8C. Okay, let's go to the next one. The ninth one. For thyroid, which one is true? So there are various statements for the thyroid. The thyroid isthmus crosses the thyroid cartilage. Thyroid isthmus is the one. So now here is a thyroid gland. This is called the isthmus. This is the lobe. So thyroid isthmus crosses the thyroid cartilage. Does it cross? Is the question. Ninth one. It does not cross. This is wrong. The superior thyroid artery are branches of the internal carotid artery. No, it is a branch from the external carotid artery. So this is wrong. The posterior surface lies on the carotid sheath. The posterior surface lies over the carotid sheath. The posterior surface of the thyroid gland lies over the carotid sheath. Yes, it lies. And then it also, the inferior thyroid arteries are branches of external carotid. No, inferior thyroid are not branches of external carotid. Recurrent laryngeal nerve passes anteriorly to each lateral lobe. That is also wrong. So with all these things, you must remember recurrent laryngeal nerve, it hooks on to the aortic arches. So it has got nothing to do with the thyroid. So this is the correct statement. Ninth one has the statement C. So this is the statement 9C is the correct answer. Next one, we'll move on to the next one. That is for great neck vessels, which one is true? For the great neck vessels, which one is true? The carotid sheath contains ansa cervicalis, vagus, recurrent laryngeal nerves. The external carotid artery has 3 branches. No, it has 8 branches. Next, internal carotid artery has 6 branches. That is wrong. Internal jugular vein lies lateral to the carotid artery. So this is the sheath. This is lateral. This is medial. And this is the carotid sheath. And this is what you can see. The carotid artery, internal jugular vein. It is lateral. This is medial. And here will be the vagus. This is how they are present. All right. Next one. That is about the 10th one. So what is the answer for the 10th one? The answer for the 10th one is D. So this is the wrong statement. This is wrong. This is wrong. This is correct. This is wrong. Okay. So the answer here is 10D. All right. Let's go to the next one. The blood supply of Little's area. Where is this Little's area? We are talking about the nasal cavity. Nasal cavity has a small area in front which is called the Little's area. It is best described by what? It is best described by what? There is a anastomosis between the facial artery maxillary artery and ophthalmic artery. It is called epistaxis. Yes. The bleeding from that region is known as epistaxis. So which one is correct? The blood supply to little area anterior-inferior part of the septum is best described by blood supply. We are talking about anterior and posterior ethmoidal arteries from ophthalmic. Which one? The spinopalatine branch of maxillary artery, spinopalatine artery and septal branch of superior labial branch of facial artery, and all these branches. Now here we have branches from ophthalmic, maxillary and facial. So I would say it is all of the above. Lacks. Yes. So all of the above. Correct. Next one. The septum of the nasal cavity is innervated by. So now here we have nasal septum. It is innervated by which one? Nasal septum is also called the medial wall. What is the innervation of the medial wall? Is it nasopalatine nerve? Is it posterior ethmoidal nerve, greater palatine, lesser palatine, or none of the above? So which one? Which one do you think? The nasopalatine, posterior ethmoidal, greater palatine, lesser palatine, or none of the above? Give you a few seconds to think which one is the correct. Which one is the correct answer? So there is nasopalatine nerve from cranial nerve. That is this is the trigeminal. It has this branch that is maxillary branch. Okay. Now who is answering this? You think it is B? Is it ethmoidal? Nasal septum. Think properly. Is it ethmoidal, posterior ethmoidal? The two. Posterior ethmoidal is way too far. It is very close to the palate. So you have to, it is actually close to the palate. So nasopalatine branch of the maxillary nerve is the answer. This is the answer. The answer is 2A. And here it is 1D. Okay. It is not lesser palatine. It is not greater palatine. No, these are not the ones. The answer is nasopalatine. Okay. All right. Next one. The posterior cricoarytenoid, I told you there is only one muscle which will do the abduction. The rest all will do tension, relaxation, act as a sphincter. See which one will do adduction? All muscles. Except posterior cricoarytenoid. Which one will do which is a tensor? Crico. So this one will do abduction of the vocal cord. So the posterior cricoarytenoid are the only muscles will do abduction. So you must remember the action of vocal cord. You have to know the table which has all these 8 muscles and each one of them has different function. So only one muscle for abduction, that is posterior cricoarytenoid. So the answer is 3A. Okay, so this much you have to remember. Next one, last question we'll take. The superior laryngeal nerve. So there is this vagus nerve which gives branches. Superior laryngeal nerve. What is the correct statement? It divides into. Okay, what do you think is the answer? The superior laryngeal nerve divides into internal and recurrent laryngeal, supplies the cricothyroid muscle, supplies the intrinsic muscles of the larynx, is sensory to larynx below the vocal cords. None of the above. Which one is the answer? Which one do you think is the answer? Which one do you think is the answer? Who is answering this question? Anyone? Any idea? Fourth one is A. Divides into internal and recurrent laryngeal nerves. Superior laryngeal nerve divides into internal laryngeal and recurrent laryngeal nerve is the right statement, correct statement. So the answer is 4A. Okay. We're almost at the end of this session. So quickly, I would like to ask you to, follow and like. And also subscribe for the MCQs and other things that we post. And there is this free classes, which is actually YouTube classes. And then we have this special classes. Which will give you a glimpse of what we do in plus classes. So this is with the subscription, you can have maximum and endless, access to various things. You have PDF notes you can access to, and you have Telegram link where you can join. And you can also download all this PDF, and you can also have a playlist of various topics, and you can download them. So all this is possible when you subscribe. So kindly subscribe and follow, like. ROHAQUA is my username, and you can also follow me at ROHINIYN. Okay, so this is my name and this is my username. With all these things, you can get various benefits. You can use my code ROHINI for YouTube, and also ROHINI 10. This number, you can use this as the promo code for all the special class users, and then you can get a discount of 10% when you subscribe for plus classes. So you can try all these options, and with this note, I'm going to sign off. Me, Dr. Rohini, signing off, and see you all at